Collective of Nine.
CIS. Period.
We're in the building.
We are the hosts of a CIS podcast, Through Their Eyes and Their Words. We will be discussing topics of interest to the youth in our community. Our topic for today is COVID-19 and how it impacts our lives. The main impact COVID-19 has had on us, the youth, has been mental. To be isolated from my family and friends, being unable to attend school, and being afraid of catching COVID or giving it to family members who are at risk is difficult for us. So we will be having a discussion today to help us better understand the importance of the restrictions. Some basic facts about COVID-19 are elderly people and people with underlying health issues are more susceptible to catching it. It started in Wuhan, China. The USA is leading the world in number of deaths related to corona. Some things we can do to help reduce the death toll are use sanitizer when soap is not readily available and stay home. At this time, I would like to introduce our guest today, Mr. Kevin Hall. Mr. Hall is the Communications Officer for the Lexington Fayette County Health Department. He will answer some basic questions for us concerning COVID. So, Mr. Hall, what are the biggest myths about COVID-19?
Well, first, let me say I appreciate you all taking the time out of your day to ask me these questions and how honored I am to be a part of this because this is the first interview I've done with young people on this. So I think it says a lot about what you're doing to try to educate your peers and your friends and anybody who is your age. This is really wonderful to be able to take this time, particularly addressing something like that first question. What are the biggest myths? One thing that for your age group that we hear often is that you're not affected by it, and that couldn't be further from the truth. While it is true that you're not going to get as sick and have the complications that an older population would have, you can still get sick from it. You could get it and not have any symptoms at all, and then risk spreading it to your parents, to your grandparents, your aunts, your uncles, any of the family members or loved ones or friends who are close to you who are older. So think for just a minute about a grandparent, if you will, who may have some underlying health conditions. They may have asthma or cancer or diabetes. If you get COVID-19 and don't know it, you can give it to them and they can get very sick. And unfortunately, what we're seeing is that people in that age range, people who are 65 and older, are the ones who are dying the most from this in Lexington. So the young people of Lexington, the young people of throughout the United States can be and are being affected by this. And we also don't know the long-term impacts to your health and what this will mean years and years on the road. Another big myth we hear quite often is that this isn't serious, that this is overblown. And again, that is just simply not the case. In public health, we've not seen anything like this in probably 100 years or more. This is spreading. It's spreading rapidly. It's throughout the world, and we still don't know what's going to happen years down the road to your health from this, as I mentioned earlier. It's not over. This is not connected to politics. It's not connected to one political party or another. It was definitely not connected to the election. It's not going away until we work together to do some things to be able to slow the spread. You hear often people saying this is no worse than the flu. And this is not to downplay the flu. The flu is very serious, and the flu can make you get very sick, can get you into the hospital, can unfortunately also kill some people. But this is more easily spread than the flu. There's no vaccine. There's no way to really treat this right now. And that's why we need people your age and others to talk about it. So great question. Those are some of the biggest myths that we hear.
Hey, I'm Danny and I'm in the 9th grade. Kentucky has 143,000 cases. Death toll is 1,757. Positivity rate has increased to 9.10%. Mr. Hall, are there things you can do to slow down the spread other than washing hands, social distancing, and wearing a mask?
Again, great question. One of the things that you can do is take those things you just said, wearing your mask, wearing it properly. That's an important piece. Not just on your face. It needs to cover your mouth. It needs to cover your nose. It needs to be secure against your cheeks. And you want to clean it often, every day or two. Make sure you clean it. When you take it off from taking it around your ears. You don't want to handle the mask. You want to get the germs on there. But so wearing your mask, social distancing, and washing your hands, those are great. But do what you're doing. Talk to people about it. Tell your friends. Tell your family. Tell anybody that you can who will listen to you why it's important to do those things. Just by taking the time today to ask questions of the health department and to put this information out into the public, you're taking a huge role in slowing this spread. Talking about it, asking questions is so important. It is never a bad thing in any capacity to ask something that you don't know the answer to. To desire that education and knowledge is very, very important. And this is a virus that the world has never seen, we're still learning so much about. So we want people to feel comfortable asking questions. And it's in our human nature to act like we know everything, to be uncomfortable asking questions. Nobody likes to stop and ask for directions. It's admitting some level of ignorance. And that it's something that we need to fight during this. I learn something new about COVID-19 every day. I am not a doctor. I'm not a nurse. I worked in journalism before coming into this job, into public health. So I love asking questions from the experts, like our health commissioner and our nurses, to learn more about it. So ask those questions and then share the information that you have with others. But again, I want to see other things that you can do to slow the spread is really just to talk to people. Let them know why it's important to you. Let them know why you wear the mask. It is to protect them and to protect their loved ones. Too often right now we're seeing people on social media or people in stores fighting about this. They're argumentative. They're challenging others. And right now maybe we try a kinder approach to let them know this is why it's important for me to do it, and I'd ask you to be the same and do the same for my family.
Hello, my name is Jacob. I'm in the 7th grade. It is a pandemic. It can live on surfaces for hours or days. Cardboard for 24 hours, stainless steel, and plastic for 2 to 3 days. People with type A blood are more susceptible to the virus. Mr. Hall, when do you estimate the pandemic will end, or do you think it will end?
You all have got great questions, and I wish I knew the answer to this. And if I did, I would be on the international news, I'm sure. In terms of I think it will end, yes, I can say I do think it will end in some degree. Now, this may be something, if you listen to some of the national experts and international experts, they think that COVID-19 in some form may be around for years and years, something that we're going to have to learn to live with and adjust our lives around, similar to the annual flu. But in terms of how we're living our lives now, where we can't go out like we're used to, we can't be around our family members, schools are closed mostly to in-person learning. Yes, I do think that will end. And our goal right now in public health is to keep as many people alive and healthy and not spreading the virus until there's a vaccine that is widely available and effective. So once that vaccine is available and it's able to get into as many people as possible, things will start changing. Now, we'll still need to wash our hands. That will never go away. And we'll probably still need to wear our masks at least for another year or two, according to Dr. Fauci, for one. I've heard him talk about how masks will be a part of our lives for quite some time. So this isn't going away, but it will change dramatically once a vaccine is widely available. Great question. Thank you for that one.
Hi, I'm Joseph. I'm in the 7th grade. Most children are asymptomatic. Reinfection may be possible. Mr. Hall, how do you know the vaccine will work for everybody?
Again, great questions. You all are going to be, if any of you all are going into journalism, I would encourage it. You've got great questions. We don't know right now if it will work for everybody. That's why it's being tested. That's why there are so many clinical trials. They want to do very rigorous testing to make sure it is effective and safe. And it's going to be like with the flu vaccine. It could be like the flu vaccine. It's not 100% effective because it changes every year. It's sometimes 40 to 60% effective. Looking at things like I'm trying to think of another vaccine that's has a higher effectiveness rate, hepatitis, for instance. Those are things, those it doesn't mutate, they don't change. So I don't know yet if COVID-19 is going to be in that form. How will we know if it's effective for everybody is, one, getting people to take it and getting it slowed down. Beyond the vaccine itself being effective, here's a little wrinkle for you. It's the messaging about the vaccine that's going to be so important. And how effective is that going to be? We already have people who don't trust vaccinations. They don't believe in the science behind them. And I'm here to tell you that the science is real, the science works. What we want people to do is to get vaccinated for flu, for hepatitis, for all the things that we push those vaccines for. And then ask questions about the COVID-19 vaccine. If you're uncomfortable, ask your nurse, ask your doctor, your medical provider, ask the health department. We need to make sure people know how they can get it, where they can get it, and what the impact will be. If it's safe, how safe is it, how was it tested? And that's part of what we'll be doing in public health.
What can young people do to help?
What you're doing right now is a great start. I am awed sometimes by young people because you all are often people my age. I'm in my mid-40s. People my age can often look at kids and young people and think that you don't understand the world. And while you do have a different, it's not that you don't understand, you have a different perspective on it. Your whole future is ahead of you, and you're so creative. And I ask you to use that creativity to work with us on getting people to pay attention to this. So it's whatever means that you have to talk to your friends, to talk to your teachers, to talk to the people in this room with you. Social media is still pretty new to me. I didn't grow up with it. You all are so used to social media. So what forums do you use to speak to people? 2 years ago, it would have been Snapchat probably, and now I think TikTok is the one everybody's using. And probably by the time we finish this interview, there will be a new app that is available and widely used for young people. Use that to talk to them about why this is so serious and why it's so important. And then to also, another thing young people can do is let us older people know you want to help. Let us know that you're listening and that you're here and you're available. When this group reached out to me to ask if I would be interested in talking, I couldn't say yes fast enough. I will speak to kids and young people as often as I can, and the fact that you're showing an interest in this speaks volumes to what you're doing, to this program, to this Lexington and overall. So keep doing that. Keep asking those questions and get the channels of communication open, whether it's your parents, your grandparents, any caregivers, any adults that coaches, teachers, choir directors, anyone. Keep that conversation going and let me know and let the health department know how we can help you.
Can you tell us what contact tracing is and how it works?
Great question. It's on the minds of everyone right now because the governor has been telling people that we need your help. If you get the call about contact tracing, to answer that call and to answer honestly. So I'm going to talk very basically about it, because that's not my world, and I can only speak to some high-level parts of it. And so essentially, if somebody tests positive for COVID-19, if I test positive, they will call me. They will, one of our staff from Lexington will call and ask me questions, where I've been, who I've been around. We want to find out who that person has been in close contact with. And close contact right now is being at least 6 feet or closer than 6 feet for more than 15 minutes throughout the day. So that's a lot it can be a lot of people. That's why we tell people to stay 6 feet apart and to stay home and away from others as much as possible. Now, once we have that list of who I've been around during my infectious period, who I possibly have exposed to COVID-19, then calls will be made, text messages will be sent to those people to try to find out, to let them know you have possibly been exposed. Here's what you need to do. What we're finding are a couple of problems. One, people aren't answering their phones. They're not returning our messages. They're not answering our texts. They're just avoiding us entirely. Or if we do reach them, they're not cooperating. All the information is private. It is not shared except internally at the health department. We're not going to tell if you test positive. We're not calling your neighbor and saying, well, guess what? This person, Johnny over here tested positive, and you may have gotten it from him. It's not like that. It's very private. It's just that you have possibly been exposed to COVID-19. So that's really where contact tracing is right now, and we need people to answer the calls, the texts, and answer honestly.
What advice do you offer for people who test positive?
The world has never seen that we're still learning so much about. So we want people to feel comfortable asking questions, and it's in our human nature to act like we know everything, to be uncomfortable asking questions. Nobody likes to stop and ask for directions. It's admitting some level of ignorance, and that it's something that we need to fight during this. I learn something new about COVID-19 every day. I am not a doctor. I'm not a nurse. I worked in journalism before coming into this job, into public health. So I love asking questions from the experts, like our health commissioner and our nurses, to learn more about it. So ask those questions and then share the information that you have with others. But again, I want to see other things that you can do to slow the spread is really just to talk to people. Let them know why it's important to you. Let them know why you wear the mask. It is to protect them and to protect their loved ones. Too often right now we're seeing people on social media or people in stores fighting about this. They're argumentative, they're challenging others. And right now maybe we try a kinder approach to let them know this is why it's important for me to do it, and I'd ask you to be the same and do the same for my family.
Where can people get tested?
You can get tested at many places in Lexington, and honestly, that changes pretty rapidly. One of the best things you can do is go to BeReadyLexington.com. That's the emergency management website, and they have that updated weekly. The mayor's office, the City of Lexington website, they put that information out there. There are several places beyond just the medical providers that have that, and that number of testing options is growing. One thing I would really like to speak to, though, is if you don't have transportation for any reason, you don't have a car or a vehicle, you're sick and can't get on the bus, you're taking care of a sick person and you can't get out, or you're symptomatic and you shouldn't be driving or going anywhere, we have at-home testing through the health department. If you live in Lexington and you don't have a way to get to the test sites, you can call us for a free at-home test kit. It's 859-899-2222. You can call 8 to 4 every day, and they're by appointment. You just let us know. We'll schedule to bring one out to you. We drop it off. You take the test. We wait there while you take the test. You administer it yourself. You just there's guidelines, there's instructions. You stick the swab up your nose, and then we collect it and take it to the lab for you, and you get your results in 2 to 3 days. So 859-899-2222 to get one of those at-home tests, and they're free. Absolutely free. Don't need insurance. They're free. That number that I gave too is also a number that you can call with any questions that you have about COVID-19. We want you to ask questions. We want you to learn about this. So give us a call. We're glad to help. Well, I'm glad to have done this. And again, I can't say this enough, and I'm very sincere when I'm saying this, is that it is a true pleasure to be a part of this. I hope that you all will reach out if you have follow-up questions or anything that you need in the future, because you are one of our former commissioners, the late Dr. Rice C. Leach, would say that you are now deputized public health communicators, because anybody who talks about public health is a public health communicator. So thank you for that, and I look forward to working with you in the future. Thanks a lot, everyone. You'll have a wonderful day.
We thank you for listening in today, and hope you'll come back next month when we interview Kentucky's youngest elected official. Today our topic was COVID-19, Corona or the Rona. Remember to make a difference in your community and help decrease the infection rate. Wash your hands, wear a mask, and stay 6 feet back. If you have any questions or comments, please let us know at ciswindstream.net or Facebook or Instagram. Hashtag at CIS Lexington.
9.
CIS. Period.
We're in the building. our eyes and our words.
Hear the bigger picture.
Planting seeds for the future.
For the bigger picture.
Community solutions.
That's the bigger picture.
And we ain't gotta hate, we can get
Picture.
through our eyes and our words, we can change the climate. We about action, pick the verbs, that's the perfect timing. Through our eyes and our words, we gon' speak the truth. In the class, in the street,
That's enough.
see the world through our lens, it's too real to pretend. Bringing violence to an end.
That's enough.
All the raging is unity, we just putting on for our community.
That's enough.
CIS opportunity, we don't do truancy, action speak fluently.
That's enough.
You don't hear us, you gon' feel us as we speak it truth to light. Hands down, we the realest. Through our eyes and our words,
Hear the bigger picture.
planting seeds for the future.
For the bigger picture.
Community solutions,
That's the bigger picture.
and we ain't gotta hate, we can get it with you. Through our eyes and our words, we can change the climate. We about action, peep the verbs, that's the perfect timing. Through our eyes and our words, we gon' speak the truth. In the class, in the streets, in the booth.
Yeah.
Yeah.